Hello, I'm Gilles Salles from Memorial Sloan Kettering in New York. And a few of you may have attended either in presence or virtually to the 10th or 11th annual meeting of the SOHO event in Houston a few days ago. This is a great meeting, and there were many sessions dedicated to lymphoma with some updates on major topics. I think the session that I found most interesting was the session dedicated to follicular lymphoma. The first speaker was Dr. Jessica Okosun from Barts in London. And you all know Jessica is an expert in the whole field of follicular lymphoma biology. And she reviewed with us the clinical parameters, but also the biological insights regarding how we can predict patient's outcome with initial data. We do know the clinical data, and she emphasized the findings around the M7 FLIPI, including a panel of mutation with the ECOG and the FLIPI scores that was developed years ago, with the 23 gene panels that we developed based on gene expression arrays, or by some immune changes in the lymph nodes, such as the proportion of T cell and immune cells, which might predict the outcome. I think these investigations are really important and help us to better understand the biology of the disease. But unfortunately, none of them is really ready for prime time. And this is probably the reflection of both the spatial heterogeneity of follicular lymphoma, where different lymph nodes may contain different type of alterations, and the lack of validation of many of these index when we change treatment, underlining the strong interaction which exists between the different treatments we applied and this biology of the disease. The second talk was presented by Dr. Carla Cazzulo from New York State. And Dr. Cazzulo presented the different tools we have to manage patients with early failure, the so-called POD24 patients, discussing new immunotherapies, such as the combination of rituximab lenalidomide, discussing CAR T cell and bispecific in this filling, as well as autologous stem cell transplant. I think, as we know, a couple of these patients unfortunately progress early with transformed disease and should be managed accordingly, while other options are available for this patient. And this was an interesting discussion. As usually with follicular lymphoma, we should individualize the therapeutic decision. The third presentation made by myself was discussing the role of bispecific antibodies, and particularly the ones that are developed in follicular lymphoma, essentially mosenutuzumab, odronextamab, and as well as epcoritimab, glofitamab being left aside. As we know, this antibody targeting CD3 and CD20, and the overall response rate of the phase 2 trials that have been developed provide us in the third line setting an overall response rate of 80% or more, and a complete response rate usually on 60% for mosenutuzumab, I think higher with odronextamab, and results pending for epcoritimab. As we know, there are also some side effects related to the first injections during the first cycle, which could be easily managed in follicular lymphoma patients with premedication and steroids. We see that there are really a high rate of response and some insight regarding the prolonged response that have been observed. For instance, in mosenutuzumab, I think about 3/4 of the patients who responded were still maintaining that response at 2 years, but obviously we don't have a longer follow-up. But this clearly represents a very important information. I should conclude that one of the questions asked by the audience, Dr. Wachewski, actually related to the depth of response and the potential use of ctDNA to monitor, and we are clearly missing data in this field. And this echoed the presentation of Dr. Okosun, who also mentioned that the monitoring of patients with follicular lymphoma over time may allow us to identify patients with particular panel of mutations or with different response. So more to come in this field, but clearly an interesting discussion regarding identification of patients with poor prognosis, management of patients with early disease, and how follicular lymphoma will find the space in the field alone or in combination with other agents. Well, thank you, and let's follow the field for new to come in future meetings.